The most important thing to know about screening is that it's for asymptomatic people, people without symptoms. If you have pain, if you have constipation, bleeding, then that's not screening anymore. Then you have to be investigated for symptoms. Screening is for healthy people, and the purpose of screening is to pick up cancer at an early stage when it is most curable. Many people are afraid of cancer, but the truth is that cancer is curable if you pick it up early enough. For example, if you have stage 1 colon cancer, the cure rate is 95%, 90 to 95%. If you have stage 1 breast cancer, then your cure rate is also 90 to 95%. So it's important to pick up cancer before it becomes advanced, before it spreads. Screening has been shown to be beneficial for breast cancer, for colorectal cancers, for prostate cancers, for cervical cancers, for lung cancers. Different cancers have different ways of screening. For example, for breast cancer, we often use mammogram and ultrasound. Lung cancer can be screened using what we call a low-dose CT scan. A low-dose CT has actually very, very little radiation, and we use it to screen people who are smokers. Smokers have a much higher risk of developing lung cancer, as much as 4 to 5 times higher risk. And this can be screened, and they can go for annual, once a year, low-dose CT of the lung. So I'm a medical oncologist. Every day I treat patients with cancer. Every time I see a patient come in with cervical cancer, I feel that this is really a big pity because cervical cancer is so preventable. It's preventable through vaccination. It's preventable through screening. What I really want to emphasize is that prevention is really the best cure. Prevention is really the best form of treatment. Probably just like to urge people to look after yourself. It's not just sufficient to eat properly, to exercise. All that is important, but you have to take an extra step. Take 1 day of leave a year, and this is your day, and go for cancer screening.